Hello, and welcome to today's webinar to recap Rare Disease Week on Capitol Hill. My name is Stacy Ward. I'm the Director of Family and Medical Support for the Prader-Willi Syndrome Association, USA. Today, I'm going to share my experience of Rare Disease Week on Capitol Hill with you. But before we start with that, I'd like to share a little bit of information about the Prader-Willi Syndrome Association. In 1975, parents Fosta and Jean Dieterling learned their child had Prader-Willi syndrome. A referral to the Child Development and Mental Retardation Center, now known as the Center for Human Development and Disability, at the University of Washington, brought the Dieterlings together with other parents and professionals acquainted with the syndrome. Together, these committed individuals formed a group called Prader-Willi Syndrome Parents and Friends, now known as the Prader-Willi Syndrome Association, USA. Four decades have passed since PWSA USA's founding, and we remain unique in terms of the breadth and depth of all that we offer. For over 40 years, the commitment and support of our community has enabled us to fund life-changing research, deliver life-saving resources and support, and spread awareness and education to make the PWS community stronger than ever. PWSA USA continues to be a self-sustaining, internationally recognized leader, empowering those affected with Prader-Willi syndrome to enjoy a productive life in an informed and accepting community. PWSA USA is a collaboration of families, individuals, researchers, healthcare practitioners, and professionals working together to strengthen efforts in areas of awareness, family support, research, education, and advocacy. These 5 pillars serve as the foundation of who we are, what we do, and what we can yet accomplish as we work together to improve the lives of those affected by Prader-Willi syndrome. Now let's spend some time talking about Rare Disease Week. February 25th through the 28th, I, along with 800 other rare disease patients, caregivers, and advocates, attended Rare Disease Week on Capitol Hill. This event was hosted by the Rare Disease Legislative Advocates, which is a program of the Every Life Foundation for Rare Diseases. There were over 200 different rare diseases represented. In a city where partisan bickering is rampant, coming together as one party, the Rare Party, was really special. As the Every Life Foundation states, we are not elephants or donkeys. We are zebras. The week began with a Rare Disease Congressional Caucus briefing, followed by a screening of Tin Soldiers. Tin Soldiers is a documentary about fibrodysplasia ossificans progressiva, also known as FOP. It's a rare disease that affects the muscles and connective tissues. Essentially, individuals grow a second skeleton. I strongly encourage you to watch this documentary. It was incredibly inspiring. The legislative conference on Wednesday started with a powerful presentation by Mark Dant, the board chair of Every Life Foundation. Mark shared his story as the father of a young man with MPS I, and there wasn't a dry eye in the room. Mark, through grassroots fundraising, raised $1 million to purchase the equipment used to develop the first drug to treat MPS I. Never doubt your impact as one person making a difference. One person single-handedly changed the future for individuals diagnosed with MPS I. More than 600 advocates attended the legislative conference in person, while another 135 participated remotely. During this conference, we learned about rare disease policy. We were prepared for our Hill meetings with the members of the Congress and the Senate, and had the opportunity to network and brainstorm with other fellow advocates. As part of the legislative conference, they provided us with 6 different legislative asks that we could speak with our representatives about. I'm going to share those legislative asks with you. The first one was to support the creation of the Rare Disease Center of Excellence at the U.S. Food and Drug Administration. The FDA plays a critical role in bringing cures into the hands of patients through the review and approval of innovative medicines and devices. A center of excellence within the FDA that focuses on rare diseases would elevate rare disease expertise within the agency and hopefully increase and improve the rare disease therapy development process. 3 years ago, the FDA established the first Center of Excellence, the Oncology Center of Excellence, which has brought new cancer therapies to patients, and it's been incredibly successful. Given the challenges and therefore the unique expertise needed to advance the development of rare diseases, a Center of Excellence would provide those necessary resources. The second legislative ask was to enact the Newborn Screening Saves Lives Reauthorization Act. On September 30th, 2019, the screening programs expired, resulting in the failure to pass it was a result of the failure to pass the Newborn Screening Saves Lives Reauthorization Act. Although Prader-Willi syndrome is not currently on the screening panel that is happening across the country, we can't advocate to have it added until this passes. So in order for us to do that, we need everyone to support this and get it through the Senate. It did pass through the House, and it has been at the Senate, and we would like for the Senate to pass it at the funding allocations that the House had passed it at. Essentially, newborn screening saves lives, and for the Prader-Willi syndrome community, if we could have PWS added to the screening panel, it will speed up the process of treatments and early diagnosis as well as early therapies. The third legislative ask was to increase the funding for the U.S. FDA Orphan Drugs Clinical Trial Grants Program and the Natural History Grants Program. So currently, Congress allocates funding to these agencies every year. The problem is there's not enough funding being allocated. In 2019, there was only enough funding to fund 12 different clinical trials. And as many of you know, clinical trials are incredibly expensive. Without additional funding, it's delayed by there not being enough funding for more and more clinical trials to happen. So our ask was to ask each of our representatives to support increased discretionary funding. The fourth legislative ask was to ask our representatives to join the Rare Disease Congressional Caucus, which is chaired by Representatives Butterfield and Billerickis and Senators Wickers and Klobuchar. I had the opportunity to listen to the four co-chairs speak about the Rare Disease Caucus and rare diseases in general, and I walked away from their presentation truly feeling as if they care about the rare disease community and are trying to do their part to ensure that funding gets increased for the rare disease community, as well as legislative asks that are either at the Senate or at the House level are getting passed. The Rare Disease Caucus is bipartisan, although there are many, many more House members as members of the caucus than there are senators. The rare diseases affect more than 30 million people, and 1 in 10 Americans has a rare disease. So many of our governmental representatives have some sort of contact with the rare disease world. So this is and should be something that's important to them. The fifth legislative ask was to support the Better Empowerment Now to Enhance Framework and Improve Treatments Act. Progress has been made to include the patient experience data into the review process at the FDA. However, there are still some significant gaps. Currently, the FDA's signature tool to evaluate the benefit risk does not have to include data from the patient perspective. The Benefit Act will amend the Food, Drug, and Cosmetic Act to ensure that the patient experience and data be considered as part of the benefit risk assessment. Legislative 6 ask was to correspond to the Medical Nutrition Equity Act. That's being sponsored by Senator Casey and Representatives McGovern and Herrera Butler. For some with rare diseases, specialized medical nutrition is medically necessary for the safe and effective management of their digestive and metabolic disorders. While the specialized nutrition is essential for patients to thrive and to avoid adverse health consequences, health insurance does not uniformly cover the medical nutrition. The Medical Nutrition Equity Act would ensure that both private and public insurance would cover the nutrition that's needed. Now, Thursday was a really big day for us. It was Hill Meetings Day. I live in New York, so I was able to meet with the offices of 5 different representatives from New York State. Congressman Delgado, Congressman Zeldin, Senator Gillibrand, Senator Schumer, and Congressman Tonko. New York had 35 advocates attend Rare Disease Week, so we were divided into smaller groups, in most cases groups of 4 or 5, to meet with our congressman representatives, but collectively met as a whole group with our senators. I was incredibly fortunate to be the only advocate who was able to meet with Congressman Tonko, who met with me directly. We spoke for more than 20 minutes about Prader-Willi syndrome, and he showed genuine interest not only in continuing to support the rare disease community, but the Prader-Willi syndrome community specifically. I've been lucky enough to have several conversations with him since Rare Disease Week, and I'm really excited to see how we can continue to partner with him in his office moving forward. The evening ended with the Rare Artist Reception. The reception highlighted the work of 14 rare artists selected from over 500 submissions. Each artist shared their experience with their specific rare disease and how art has impacted their lives. Jennifer Virag, one of the Rare Artist winners, submitted a photo of a burst of light from a fireworks show that my husband did. I didn't know Jennifer before this event. I hadn't seen the picture before this event. She had been a part of my smaller group, and as she was being introduced to us, and it was shared that she was a rare artist, we started talking and realized the irony in all of this. It was really very exciting. So for a rare disease community that's 300 million strong, in that moment, it felt really small. Rare Disease Week is only one amazing week each year. Our jobs as advocates for the rare disease community, and specifically the Prader-Willi syndrome community, is to speak up and advocate every single day. PWSA USA has a Public Policy Action Center, referred to as the PPAC, that makes sharing your concerns with your government representatives super easy. If you click the link above, you can take action and contact your representatives about the 6 different legislative campaigns we have going on, as well as share just the educational campaign. And the idea behind the educational campaign is not to ask your representatives for anything, but instead to educate them about Prader-Willi syndrome. So when we do ask them to support something that benefits the Prader-Willi syndrome community, they will have heard the name of the syndrome before that. I'd like to thank you all for joining us and taking the time to listen to this. If you have any questions about public policy advocacy or the Rare Disease Week, please don't hesitate to reach out. I encourage all of you as rare disease advocates to look into the possibility of attending Rare Disease Week. It truly changed my life. It was an incredible experience. Thanks so much.